Good morning and welcome to the announcement of the Mental Health International Report on Mental Life in Canada. Please note that your microphones are on mute, so to ask questions at any time, please use the chat function. Now, please welcome our MC for this meeting, Dr. Tom Nicholson, President and Chief Science Officer of the Ontario Brain Institute.
Good morning and welcome. So I'm very pleased to have joined you for this special launch event and announcement. Joining me online for this presentation are the Honorable Bill Wilkerson, who is the co-founder and Chairman Emeritus of Mental Health International, and Joe Ricciuti, co-founder and Chairman, Mental Health International, or MHI. As you can see, as mentioned, everyone's microphones are on mute, but during this event at any time, if you want to ask a question, please submit it via email, and you'll see the address below. Jill Stringer from MHI will gather the questions for us to answer at the end of the presentation. So now on to our announcement. So as you may know, as a world leader in brain research, commercialization, and care, the Ontario Brain Institute is on a mission to accelerate the discovery of innovation benefiting both patients and the economy. We have a collaborative team science approach which promotes brain research, commercialization, and care by connecting researchers, clinicians, industry, patients, and their advocates to improve the lives of those living with brain disorders. So OBI is a proud partner with Mental Health International, and we're very pleased to support the launch of the Mental Life in Canada report. So I'm going to now invite Joe Ricciuti, who's the co-founder and chairman of Mental Health International, to say a few words and to introduce the report's author, Bill Wilkerson.
Well, thank you, Tom, and welcome everyone. Let me start. For those who are not familiar with Mental Health International, it's a not-for-profit organization, and its purpose is to act as an aggregator across international borders to unify data, ideas, and leaders of business and science to promote and protect the mental health of working populations. And to Tom's point, Mental Health International is also pleased to partner with Ontario Brain Institute as we unlock the recommendations in the Mental Life in Canada report. Bill Wilkerson has created an opus of sorts for us to enjoy. Like an orchestra, he has considered each instrument and how they work to pull them into a great harmony that resonates as one of the most important pieces of our mental life. Mental health is a burden growing, and despite increased treatment services, prevalence rates have not budged. The Mental Life in Canada report constitutes a call to action. The report argues in favor of human well-being as a unifying national goal. There is no question, no issue, no concern more unifying in Canada than the hunger for action to stem this tide of suffering. The clarity and recommendations present an opportunity that Bill will now share with you. Thank you, Bill, for your dedication to producing such a fine work. Over to you, Bill.
Thank you, Joseph, and good morning all, and thank you, Tom. A couple of things, if I may, first, before we talk about the content of this report. It's that we've had an opportunity over the last 20 plus years to examine these issues, yes, from a Canadian perspective, but also from a US perspective, putting aside healthcare service delivery differences. And we've also led a campaign in Europe. And what is remarkable is the similarity, virtually the identical nature of the problems facing the delivery of mental health services and the management of mental health and the reduction of the mental health burden. So I want to say the report you're about to hear a little bit about from me has everything to do with this country, but beyond it as well. The report is dedicated to my close friend and partner for the past 25 years, actually, in the mental health arena, the late Honorable Michael Wilson. In fact, the principal recommendation in this report is something that Michael himself discussed with me and thought we should tackle. and that is to bring business and science together in a partnership. to help drive a new angle, new approach, a new frontier for mental health purposes and the resolution of the mental health burden. And it's a concept that he expected to work with us on, and then unfortunately he left us. But his thoughts and his views are captured on the pages of this report, and we're very grateful for that. And yes, to the Ontario Brain Institute, just to add to Joseph's words and thoughts, we're very pleased to have this opportunity to partner with the OBI, not only with regard to launching the report this morning, but in fact to setting it forward into motion in the weeks ahead. I also want to acknowledge and express my appreciation for the presence of Patrick Dean this morning, the principal of Queen's University. Patrick and I go back a little bit to his days as the leader of McMaster, and I am very pleased that he has granted us his time today. Mental Life in Canada examines a series of trends, and I want to emphasize we're talking trends that are happening, not wishful thinking. And it is also information in this report, which I hope you'll read. It's 90 plus pages, but it's written by a layman, so lay people should be able to get through it pretty well. That we have in this country a need that is not being met. And this is not to criticize, but is simply to report. Mental Life in Canada is the report itself displays through factual information, scientific data, that prevention at long last can be seen as a realistic course of action, as a plausible scientific strategy, and a plausible societal and economic strategy to rein in the burden of mental health. In fact, there are international voices giving power and strength to the idea. The U.S. National Institute for Mental Health, the largest funding agency of mental health research in the world, says it's the most important strategy for the future. And we are trying to pivot toward the future on that premise. Our prevention target is the 3D effects of mental disorders: the disturbance, the disablement, of the death prematurely associated with these conditions. And most importantly, for the purposes of this initiative, the societal risks that are generated by institutions and by the way in which we conduct ourselves as a society in this world. What goes on in here is not likely to be isolated from what goes on out there in the society we are part of, and in fact that we have created. To this end, our report foresees, it proposes the creation of a science business roundtable on the quality of mental life in Canada, serving, as Joseph mentioned, a unifying goal: human well-being through the quality of our mental life. From the newer science of epigenetics, we have learned that mental disorders are triggered by the interaction between our genes, the construct of who we are, and the events, the trauma, the experiences, the encounters, and the environments of life that we experience and go through day to day. As a layman, I have learned from the research of experts who claim the knowledge, and rightly so, that the human brain and its billions of cells and its superb, mysterious nature reacts and responds to the world around us. Remember, we are not an isolated creature. We are, in fact, part of the world in which we live. And therefore, brain function and brain performance respond and can be deferred, can be disturbed, can be disabled by the events that we experience in life. How we treat each other individually and as a group unto an individual, as an individual unto a group, can exacerbate the risks and perpetuate the effects. The way organizations behave, and I'm going to lean into this fairly heavily in the next 10 or 12 minutes. Organizational behavioral health is a new concept we're introducing today, because the way organizations behave has a material impact on the capacity of people to live healthy and fruitful lives. And I'll give you an example or two, either in the question period or in my remarks. Depends on how long I'm still allowed to speak here as we go forward. I'll talk about population stress. It is, in fact, a global problem. The kinds of things that are getting under the skin of people, anger, frustration, rumination, are predictors of depression, and they are now being inculcated in our society and in our way of life as a standard of living factor. Can't be allowed to continue. And of course, the pollution of social media. Now, I'm an old guy, and I got to tell you, I'm running out of steam trying to keep track of the reasons that social media should be itself contained. And I also question the neuroscientific community and ask them to consider how we manage the neurological and neuroscientific effects of these devices. Misogyny. We'll see in the data that this report provides how hatred of women and how the innocence and the experience and the suffering of children are becoming a telltale dimension of violence in Canada, not just the United States, not other places only, but in Canada. And in all of this, self-worth, a sense of self. This is not some benign psychological notion. It is everything. And Canadians make that point in a survey for the Government of Canada itself. Canadians tell the government, and specifically the Deputy Prime Minister, that what we want most from our life in this country is a sense of belonging, who we are and why we're here and what we do that's helpful and useful to ourselves and to others. We know through science that social and economic issues are intrinsic to mental disorders. And we know that the idea of prevention is driven in part by recognition of that fact. These are preventable influences. And they have become a part of the world agenda, if you will, of the World Health Organization and the United Nations Sustainability and Development Initiative. So they have a place in policy discussions at an international and high level. Mental well-being. We've found that the brain and the body are connected by a lot more than our neck. We think we should have known that all along, don't you think? But it's taking some new scientific data, new in the sense of years, not weeks, not months, to demonstrate that depression is one form of mental disorder and hasten and increase the risks of the mortality rates associated with heart disease and diabetes and other conditions. It demonstrates that the word mental in mental health and the word mental in mental disorders is an incomplete phrase, an incomplete description of these conditions. And even the World Psychiatric Community tells us there is plenty that is physical about mental disorders and plenty that is mental about physical disorders. And therefore, these distinctions, which we see in the newspaper almost every day, are false and misleading and incorrect. The quiet revolution in science is what we describe as taking place in this changing world of ours. And we know that this quiet revolution is giving us new grounds for hope and new grounds for knowledge through which we can, in fact, become a society dedicated to effective deployment of prevention to prevent the suffering before it starts. And we see the science beginning to tell us some things that are, for me, troubling in the nature of our human experience. The Quiet Revolution tells us that mental disorders are neurodevelopmental in nature. This means that our vulnerability materializes very early in life, which helps to explain the average age of early onset of these conditions. Anxiety in Canada has been pinned down to as an average age of onset, age 12. That, to me, gets our attention. Scientists believe they have discovered the neural genetic signature of schizophrenia. Well, that's an important breakthrough. Number one, it's a pathway to solving one of the most devastating forms of human suffering, but also it demonstrates that the nature of these disorders can be inherited. But that doesn't explain their evolution and advent of the suffering associated with them. That takes a social factor, a societal influence, an experiential influence. And that brings us back to the question of prevention. And in that regard, we offer a second theme or proposal in this report, which we are calling human capitalism. And it's an idea whose time has come. That business investments in human well-being should and can be incentivized through changes to tax law and accounting practices as a capital investment to make with a return, not an operating cost to cut. A number of trends substantiate the idea of an alliance between business and science to move forward on these frontiers. And one is the emergence of brain health and brain skills as essential factors in determining business success. We live in a brain economy, a digital economy where cerebral skill sets are now paramount to function. And we need to know how and when and why we're investing not only in artificial intelligence, but in human intelligence and human well-being. And that is why human capitalism, as we describe it, assigns business value to what people do in the workplace, not just to what things do in the workplace. One of Canada's foremost public companies, Brookfield Asset Management, has already calculated the asset and market value of its employees and the work they do. This strengthens enormously the business case for investing in the well-being of the working population. And to that end, we believe that investments in the so-called intangibles of business, human affairs, human function, human work, human outcomes, are in fact a substantial basis upon which to repurpose those investments into mental health and well-being. I think we need two other things, and then I'll stop. The idea of a business science or science business alliance, is going to be only as good as the people who work on it together. And therefore, I visualize, others will have their clear say on this, that we must be a convener and bring leaders together, subject matter experts together, whole sectors together to develop guidelines for the prevention of mental disorders that are associated with the behaviors of institutions. Give you an example, inflation. That is being resolved and has historically been resolved through the effects on people, not by alleviating those effects, but on exacerbating them. When we look at the government of Canada's Phoenix payroll system, a nightmare for their people, we find a coroner attributing the frustration for the suicide of a federal employee. When we look at a variety of issues that institutions do routinely, we're not blaming them for an assault on our well-being. We're saying there is a natural outcome that simply must be recognized and changed. And therefore, we see the value of brain briefings. How about that? Where we all learn a little bit more about how brain performance is facilitated and interrupted in the context of the workplace, the marketplace, and the community itself. And yes, as I mentioned, Canadians have told the government what we want, most of all, a sense of who we are, an ability to trust others, an ability to have confidence in larger institutional decision-making. Income equality, health equity has been established for the Parliament of this country to consider as a basis for an inept and, frankly, inadequate mental health care system, which exists not as a system, but as a series of random investments and initiatives. Canadians aspire to things of this nature, and we must hear that, and particularly so, I would add, with respect UNESCO calls Canada a tough place to grow up. We underinvest in kids, and kids are the subject of abuse and violent family violence at a level that is really quite startling. And we have in all of this the need to recognize that the crimes we commit as adults are not necessarily against each other, but are profoundly against children and their lifelong burden of suicidal thinking and mental distress and disorder. We discussed this in some detail. So, where does an initiative like this begins? Well, it begins in a lot of places, and we'll get to that. If not today, another time, you'll hear lots more about it. But the Right Honorable David Johnson came to us, and well, went to him actually. We had a very long and wonderful discussion. And he talked to us about the power of empathy. And to me, that is where the advancement of human well-being must begin and must end. It is both a starting point and a finish line. Our feelings toward others. Our report discusses that, and I want to draw your attention out of the 90 some odd pages of readable material I quickly add each time I say that, to page 16. And I'm going to read a sentence from page 16. It is said that empathy gives our heart the eyes to see other people's experience in life. Empathy is an expression of human love to be fostered, taught, and learned as one of the fundamental principles needed to defeat mental disorders by preventing them. Well, empathy breeds kindness. Kindness is teachable. Kindness is learnable. And according to the neuroscientific community, Tom and his colleagues, kindness activates that part of our brain that makes us feel good. So it serves a real interior purpose as well as another one among others. Being kind is good for us. Being kind in business is often thought to be extraneous, impossible to demand. I disagree with you. And I have been in business long enough to back that up. This report ultimately paints a picture of a race between hope, the science is moving forward, and heartbreak, the burden being borne and not yet lifted, especially among children and youth. It's a race we must win, a race we can win, and a race where the finish line is the starting point that defines the quality of mental life in this country. And that's the mission before us. And one might say the mission impossible? No, the mission possible, likely, and necessary. Okay, thanks very much.
Bill, thank you very much. An eloquent charge to the group. So I'm here again today to represent the Ontario Brain Institute in the support of the launch of this Mental Health in Canada report, and it's obvious why based on Bill's eloquent presentation. Over 10 years ago, the OBI set out to address brain health differently by focusing efforts broadly on brain health and supporting advances in all sectors working to improve the lives of folks living with brain disorders. Our vision was, and still is, to position Ontario as a world leader in brain research, commercialization, and care. So since our inception, we've accelerated scientific discoveries, we've invested in homegrown neurotechnology, and we've supported person-centered healthcare programs in communities. And as you'll read in the Mental Life in Canada report, the healthy brain function has even been woven into the fabric of our organization. Our founder, the late Dr. Don Stuss, was a world expert in frontal lobe function. And he's credited with deliberately bringing this idea of the brain function to the workplace through scientific knowledge of the way brain processes information in the purpose of management. He used to say that there are hierarchies of cells in the brain whose job is to organize, oversee, and direct brain functions. And that parallels very much that executives and managers operate, reflecting the division of labor around the world and how and why they're doing work. Recently, the OBI team took stock and the current state of 13 different brain disorders in Ontario through the Brain Health in Ontario project. The data collected through this initiative, in combination with other estimates, showed that 1 in 3 Ontarians are living with a brain disorder. This reconfirmation of this number emphasizes the importance and the impact of addressing brain health needs of all Canadians. So brain disorders, which include everything from epilepsy, cerebral palsy, autism, and dementia, to the range of mental health conditions, are leading causes of disability worldwide. So as you can imagine, the cumulative burden of living with less than ideal health has a tremendous impact on families, caregivers, and society as a whole. Moreover, brain disorders do not occur in isolation. The impact of mental health can affect other areas of life, such as a person's ability to maintain employment, their physical health, financial health, and social health, as Bill eloquently described. So knowing that the economic and societal impact of brain disorders, now is the time to think and act differently. So to catalyze change, we're going to proceed with a one brain philosophy and a look across brain disorders to identify common factors that can help us diagnose, treat, and care for individuals living in the community. We also need to take a team science approach. So only with sustained collaboration and integration between researchers, clinicians, industry, patients, and their advocates will we foster discovery and deliver innovative products and services that improve the lives of folks living with brain disorders. And like the Mental Health International team, the Ontario Brain Institute is in the business of championing prevention when and where possible, an early watch approach, as is referred to in this report. So we also want to ensure that organizations providing care or pathways to care for mental illness, amongst other neurologic conditions, are supported in significant and meaningful ways. So for instance, we know that a lot of mental health support is provided outside the formal healthcare system, and we need to ensure that these frontline providers are connected to the healthcare system. We have to foster sustained collaboration with research and industry that turn evidence into new technologies to support the mental health for all. And we need to make strategic investments for tools and support mental health at home and in the workplace. So with such a unified approach, the Canadian brain health community can work to come up with new insights and potentially life-changing breakthroughs. So now is the time to push for strategies that optimize brain health through strong strategic coordination and collaboration between stakeholders across public and private sectors. Together, we can work to improve access and the connectedness of the different levels of care for people living with brain disorders, including and especially mental illness. So we say time and time again that OBI's driving force is improving the lives of those living with brain disorders. But there's still so much to uncover in terms of the overall understanding of neurologic conditions, the mysteries which often result in expensive care, disruptive diagnoses, and ineffective treatments. So even so, we remain motivated by our shared long-term goal to champion our collaborative approach to improve brain health in Ontario and around the globe. So this is the central message of the MHI report released today. So thank you both, Bill and Joe, and I thank everyone for your time and interest, and we'll move into the Q&A portion of our event. So I think Jill Stringer has been collecting the questions, and Jill, if you mind, proceed with the first question.
Absolutely. Thank you, Tom. The first question is, when can people, those on the ground treating and working with patients and those with illness, see a tangible change in their lives? And what would this start with?
Well, if you don't mind, I'll grab that one first. It certainly starts with an awareness followed by the investment. Bill articulated the awareness issue and the formal value of that need for investment. We know that community organizations are doing a lot of important work on behalf of their clients in the mental health sector. Their challenge is a lack of funding and a lack of connectedness to the larger healthcare system. So we as OBI count ourselves as one of the few funders who actually support community organizations. We need more partners to shift their mindset and invest in that community setting where a lot of informal care is delivered, and to help them expand their programming and create more access for people living with mental health challenges. So we also need to acknowledge that care is not only provided in the doctor's office and in hospitals, but this informal care community. Connecting these community programs together to learn best practices and effectiveness outcomes and measures of benefit in evaluation will integrate them into a continuum of care make it more accessible and more personal. So we're already seeing change like this from our efforts. And when more funders, philanthropists, and industry sort of realize the value of this approach, we'll see more significant and broader impact in an accelerating and shorter period of time.
I add something to that. It was a very lucid and proper description of the opportunities. At the Hospital for Sick Children in Toronto, and we discussed this in the report, I should mention, there's a bit of a reformation going on, if I may use the term, whereby the hospital, across that precious gold of its clientele, is looking at mental health as an all-in service, an all-in concern that isn't just the Department of Psychiatry Services or one specialty versus another. The hospital itself is being turned over and into a total perspective on the mental health and well-being of the children who are in its care. That means, to answer the question, that the providers, the professionals, are in fact seeing results today from similar initiatives. One last thing. We must, and I say this with deepest respect for the mental health professional community, psychologists, psychiatrists, social workers, family physicians, we must reorganize the mental health professions. We must unify psychology and psychiatry. We must, in order to provide both an economically feasible service basis for Canadians, we've got to get out of this place. Right now, psychiatrists are the fourth, not the first, second, or third, the fourth most likely professional group to treat someone with mental disorders. Ain't good enough. And they're having a meeting a discussion at their annual meeting in the spring about the accessibility to psychiatry. And I say the mental health professions need to be unified and reassembled in order to see the results that the questioner asked about. Thank you.
Thank you. Our second question is, what is the role of government in this?
Tom, do you mind? Joe, can I take a crack at that first?
Oh, please.
Yeah. Government's role in this is as an employer. Government is not being reduced in our thinking by any means, but we introduced in our earlier lives an approach to the government workplace that has produced a tremendous change in the way in which internal mental health problems among federal and provincial employees are treated. That is beginning to slip. Time, people retiring, other people stepping in. So government, in my judgment, can bring to this party, I don't think we're looking for money outside of the normal and natural flow, but we are looking for their role as the country's largest employer to show leadership by example in assembling their participation in the prevention of mental disorders through the reduction of the societal risks that are at the heart of the inflamed nature of these conditions right across the country.
Joe, is there anything you wanted to add there?
No, well articulated. I'm not going to add any more color to that, but well said, Bill and Tom.
I would just re-emphasize that we have a very excellent collaboration with government sponsors, and I think this partnership idea is the continuum of influence, both the corporate sector, the company sector, the commercial sector. It's a team sport, and I think we all need to be integrated and aligned.
Great.
Thank you. Moving to our third question. You mentioned the report speaks of human capital. How do you see business changing as people become assets for development rather than expendable expenses?
Well, let me start. Let me show you or give you an example of the nutty nature of some of the things that we abide by in business and in society. Today, if a company invests in the technology associated with replicating human intelligence in the form of artificial intelligence, they get a tax break because it's construed as a capital investment. If they invest in the reskilling, health benefit, and well-being of their people, they do not get a tax break. It's treated as a cost. And human capital is now emerging as a fundamentally important, if not the most important asset for competitive purposes that business has. In fact, 80% of the asset value of public companies in this country are attributable to human capital related functions and outputs. Mark Carney, the former governor of the Bank of Canada and the Bank of England, has a new book out. I encourage us to take a peek at it because it makes the case profoundly clearly, not as clearly as he was when he was in government, but clear as a bell that we must invest in the mental arena, referring in this case to mental function, mental brain performance. And he brings a tremendous amount of credibility to that statement, which we can invest in and draw upon. And finally, Michael Wilson and I created a bit of a formula a while back called brain health and brain skills equals brain capital or human capital. And we say that is where the change is going to happen. Business will recognize that investing in the way people think, how they manage, and by way they think, I don't talk about imposing ideas, but we think through our cognitive capacity, and we function, and we imagine, and we're creative, and innovation is a deliverable of the mental health of employees. That's where you'll see the real change and the real investments going forward.
If I could maybe jump in, Bill and Jill, if I'm allowed to maybe just comment on that. I did want to recognize Henry Jaffe of Curriculum Labs, who really tackled this this topic. And if I can maybe just quote from an article and a presentation that he made to me and Bill for the mental well-being case for human capital as an asset. He started with a premise that said individual and collective mental health and well-being are reinforced when professionals better understand how individual work outputs impact the performance of the company and their compensation, and even more so when their benefits are tied to the market value of the enterprise. And the positive mental health and well-being are casually linked to many of those business outcomes: reduced attrition, improved innovation, engagement and collaboration, improved organizational trust, reduced cyber risk, reduced time to value of projects. And he calls for, and the challenge that he sees it as measuring mental health and well-being more clearly and succinctly, putting it on an asset on a balance sheet, not as an expense on the balance sheet. And until we do that, will we be really mitigating the true value of human capital, and not as an asset. So I just wanted to share that from Henry Jaffe. And for those who would like more information, we can always send those who are on the line his coordinates and contact information.
And the report discusses these matters, so you can also refer there. But that's a tremendously valuable addition to the commentary, no question. Thanks, Joe.
Thank you.
All right, next question, please.
What are the current barriers or challenges to effective collaboration between psychiatrists and other medical support persons in Canada? And how can they be addressed to improve patient outcomes and access to comprehensive care for individuals with neuropsychiatric disorders?
Well, this is obviously a very multidimensional problem, and I'll have Bill weigh in a moment, but clearly there are values in the context of bringing evidence to bear. Now, the corralling of how we actually deliver care in a standardized way with critical evaluation metrics and standardized tools to generate these evidence bases is so important. And then, of course, how they get disseminated to the care community. Bill alluded to one of the challenges, of course, is that the care delivery community is quite diverse about which type of medical professional or care provider is encountered by someone. So standardization is important. Data sharing is important. And we have several of our research programs that are trying to lead the charge in a very diverse and real world context. Finally, the other thing we alluded to is that the mental health disorders don't exist in isolation. They exist as another facet of other disorders, both physical and other neurologic disorders. So it is admittedly complicated, but I think acknowledgement of the value of standardization, care pathways, and evidence is at least the strategy that we're bringing to bear. Bill, did you want to add anything to that?
Yeah, just two quickies. One, there is no generally accepted definition of mental illness today or mental disorder. That would seem to me that we've got to get the professionals talking to each other. And secondly, I think that what becomes valuable is to see the unification of standards. Yes, as Tom says, absolutely. Also, the ideas behind diagnostic decisions are, shall we say, not coherently organized between and among the various professional groups. So care is kind of luck of the draw in this country. And I have one more thing to add to that when Tom closes out. Thank you. Yeah. Thank you.
All right, next question, please.
In terms of supporting employee mental health, which is more important in your opinion, a supportive workplace culture or enhanced employee benefits?
Joe or Bill?
Sure. Well, Bill, did you want to chime in first?
Yeah, I think they both are necessary. If I was saying, okay, Bill, that's not a clear answer. Without a hospitable, functional, healthy work environment, the health benefits ain't going to help, largely speaking. So it's the environment is crucial. Health benefits, absolutely. And our report refers to the importance of the insurance industry coming together with the scientific and clinical care community to redesign certain aspects of health benefits. I'll stop there because the real expert, not just in this panel, but in this country, is sitting there looking at me, and I'm going to hand it over to Joseph.
Well, thanks, Bill. Obviously they go hand in hand, but if you think of it, it's not even a chicken or the egg question. I mean, if you have a good culture within the organization, it will speak to providing the necessary support that's required to ensure the health and productivity of their working populations. So they go hand in hand, but it all starts with culture. And to a lot of what Henry Jaffe is saying about human capitalism, starting to recognize it as an asset. and benefits plays an important part in providing the services that may be needed when needed. And the culture speaks to that. I'll leave it at that.
Terrific. Moving on. I think there is.
If we have time for more on this discussion, building on one of our previous questions, we've been asked, how can we bridge the gap between psychology and psychiatry, especially in terms of patient education?
Well, there's no question that there is a range or a team aspect to the management of mental disorders, and different experts provide different perspectives, but it's along a continuum of care. So each of the specialties involved in community, including community health workers and obviously even family members and advocates, have a role along that continuum of care. And both psychology and psychiatry do have unique ways of approaching. It is an issue about how you resolve the various expertise along a continuum versus the heterogeneity of care, as Bill alluded to, about who the first encounter is with a provider. Admittedly, these are complementary, but it does come down to what exactly we're treating, and it has been very difficult historically to define what is the scope and extent of a mental health disorder, and the coding criteria, in fact, are admittedly inadequate. So I think a broad base and a lot of knowledge yet to be gained still to put these different disorders in context.
I would add this: the use of medication to treat mental health problems, drugs, is obviously widely deployed, widely used. In the latest data I've seen from the US is that even psychiatry is coming to terms with the fact that its members must relearn a bit about psychotherapy, which is practiced primarily by psychologists and social workers. That drugs cannot be and will not be ultimately the final solution, or even in the years ahead, the first option. So I think there's got to be, psychiatrists got to learn how to talk with their patients, to get away from the 15-minute appointments. Insurers must stop thinking that going to a psychologist is a method of talking about your lifelong ambitions and aspirations. It is about problem solving, and to limit the number of sessions the way they are currently limited is unhelpful. And finally, I think psychologists and psychiatrists and family doctors and social workers, as I said a few minutes ago, should be reordered into a single profession that has these various, Tom says, these diverse specialties, but they're operating from a premise that is shared, from an understanding that is shared about what these conditions are and are not. And the final point being, the National Institute of Mental Health has set in motion a very significant rethink of how mental disorders today are currently classified, which means how they're diagnosed. And they are saying the names, depression, schizophrenia, and other forms of mental disorders by label is an obsolete approach. So lots of change coming and lots of opportunity to do what Tom said, which is going to be in the ultimate benefit of all of us.
All right, next question.
Thank you. This will actually be our final question for this morning, and I think it's a good one to end on. What are the actionable next steps from this report?
Well, let me take that one first, and I'll kick it over to Joe. Obviously, as we've said several times, we have to push for strategies that think about mental health as being brain health, and optimizing brain health has to come through strong strategic coordination and collaboration between the multiple stakeholders. And this includes both public and private sectors. We have to focus on research, which addresses tangible problems faced by real people in the real world. We need to make sure that we're taking evidence into treatments and tools, again, that can be deployed in the real world. Brain disorders, including conditions such as mental illness, they affect all life areas, including employment and physical health, financial health, social health, and the health of the family. So that just to be acknowledged that this is embedded in our society. Knowing that the economic and societal impacts are there, it's really time to think and act, and that's what this report is all about. This integrated team science approach is what we champion at OBI, but in the larger context through the continuum of care along that care continuum, really is intended to sustain that collaboration between the diverse stakeholders, including the folks with lived experience. And this will generate knowledge and evidence for those kind of breakthroughs that we're looking for. As I said, we try to take this different approach to research that brings research in the context of the real world with all of the experts that are necessary, including researchers and clinicians and industry partners, but also patients, their advocates, and obviously in the employment context as well, employers and others that have a vested interest in mental health and brain health. Joe?
Yeah, well, thanks, Tom. Just let me add a couple of things. First and foremost, the report calls for a business science roundtable. I think it's very important for business to understand what science is doing, to inform them on what maybe they can be doing better or more for their working populations. And I think it's important for science to listen to what businesses are doing to support their employees around health and productivity. And coming together and listening to one another, clean whiteboard, I think would shape the way forward. The second point I want to make is the report documents reasons for hope. And when those of you who read it will get that message very clear. And one example that I took away from the report was the convergence of epigenetics and genomics revolutions that are taking place. And they're fueled by technological advances. And that in itself reveals new insights into the genetic architecture of mental disorders, their prevention and mitigation. And that is important to business. And science really needs to showcase that more than what it is. I know the private sector is working on that. For those who are looking for information on that subject, in our report, there's a number of esteemed individuals that are quoted. In Canada, I know that the DNA company and its CEO, Kashif Khan, are making progress in this way. So to reflect back, it's really bringing business and science to know and learn from each other, and to make this a better and safer place for working populations as they confront the challenges of mental disorders in Canada. Bill, did you want to weigh in?
No, I think that that captures it magnificently. Thank you.
Well, let me just conclude by thanking everybody for joining us today. And before you go, though, I'm going to ask Bill to share some final last words with you. But first, please watch for an email that links to the report, gives you some background information and a link to the replay here. The subject line, Mental Health Report Resources. And feel free to forward the email or share the links. So Bill, thanks for your passion, your drive, and your absolute commitment to this mental health mission and the well-being of Canadians and all people. Over to you.
Thank you, Tom, and thank you everyone who is part of this event. Thank you to Vicki Allers for organizing it, and for so many others who made this report possible because they've done the work. I did the reporting. That's how I look at it. Let me give you one telltale way to say whether you've got a mental health care system or not, whether we're taking action or not. And we crave action on this topic. Let's talk about it is now done enough of that. And the question is this: for those of us who are in distress, where do I turn? Ask that question the next time you think you need help or know someone who needs help, and you're going to find out there is no answer. There is no first step. Yes, your family physician may be helpful and try to be, but family doctors have already told government that they aren't comfortable in this field because they're not clear on so many aspects of it. So where do I turn is the answer. Answering that question is going to be the acid test of whether we are taking action or pretending to be taking action, whether we are talking or whether we are acting, whether we are ready to make change or talk about making change. Where do I turn? And if you're a kid sitting in the waiting room of a general hospital, an acute care hospital, with a suicidal thought that is beginning to take you over, the answer to that question is not even answered in that venue. And in New Brunswick this week, an inquiry has begun into the loss of life through suicide of a young woman in the care of an acute hospital in St. John. And I was part of the process that brought forward this issue for inquiry. So I ended there. Action, not words. Where do I turn? If we answer that question, and there is an answer that is coherent, an answer that is fruitful, an answer that is plausible, we know we're doing our job and change is happening. Thank you. Seems I shut everybody down.
I think that brings us to the end of our program this afternoon or this morning. And thank you so much for the attention. And Bill and Joe, thank you so much for your input.
Pleasure.
Pleasure indeed. Thank you all.